You know that unsightly bump that you have behind your heel? You're trying to wear your high-heeled shoes and it's just not working out. It's causing pain, it's causing discomfort, and sometimes it even swells. Well, today I'm going to tell you all about that. Let's get into it. All right, so I'm going to combine two topics, Haglund's deformity and Achilles tendonitis, because a lot of patients who have Haglund's deformity will also have Achilles tendonitis. Well, what is Haglund's deformity? It is a bony prominence of the growth in the back of the heel. There's really no rhyme or reason to why it happens. It just sometimes happens. Now, if there is a bone spur at the back of the heel, that's not quite a Haglund's deformity. That could also just be a bone spur that's caused by tightness of the Achilles tendon. Achilles tendonitis, now, it's inflammation of the Achilles tendon, most often at the site of the insertion, but sometimes it's usually also not at the insertion site. It could also be anywhere along the tendon. Why does Achilles tendon happen? It happens when a lot of the times there's not enough stretch in the tissue, the Achilles tendon is tight. If there's friction or trauma to the area, that could also cause inflammation. Remember, itis is an inflammation. Achilles tendonitis is inflammation to the Achilles tendon. So there are lots of reasons, like I said, sometimes when it's just tight, if there's direct trauma, sometimes if there's an infection in that area, it could also cause inflammation. And with that, if you have a Haglund's deformity, that also combines and causes tremendous amount of pain and discomfort. Now, what are some of the symptoms of a Haglund's deformity? Now, a Haglund's deformity symptoms is a visible, painful bump on the back of the heel. When you're wearing any closed-toed shoes or any shoe that go over there, it just causes a tremendous amount of pain and discomfort. So that's one of the main symptoms. Also, tightness in the Achilles tendon. How would you know if you have tightness in the Achilles tendon? How far can you move your foot in your ankle joint? When you're moving it up this way, or let's just even use this model.
Oops.
Assuming this is a foot, if you're trying, well, this is a foot, not assuming. If you're trying to move it up, this is kind of, these are not real ligaments, so it's not going to move. But does it stop here or does it move further? Can your foot move further than 90 degrees? If it cannot, then usually it's because your Achilles tendon is tight. Now, keep in mind, there are other joints in the foot that could make you think that you are moving past 90 degrees, but we really just want to check the rear foot. These joints here, are they letting you move past? If they're not, it's probably because the Achilles tendon is super tight and is preventing you from doing that. Inflammation in the Achilles tendon or Achilles tendonitis, how would you know? Well, you're going to have pain, you're going to have discomfort. Some people may even find that wearing flat shoes hurt more than wearing shoes with a little bit of a heel or even a higher heel. If you are doing that and you're finding that, then you will know that your Achilles tendon is tight, and so when you stretch it in a flat foot, just stretching and causing pain and discomfort. So that's usually also a telltale sign that your Achilles tendon is tight. Well, you have a Haglund's deformity or Achilles tendonitis. What are you going to do about it? Well, if you have a Haglund's deformity, the most conservative thing you can do is padding. Padding it, wearing shoes that will avoid having a back so it doesn't rub in that area. There's also a bursa, which is a fluid-filled sac that is behind the heel in that area there. So that fluid-filled sac sits right here and so prevents that rubbing or friction. But sometimes this bursa or that bump is just too large and it's pushing out and protruding and causing pain or discomfort. In that situation, honestly, just padding it is the best thing that you can do. Short of surgery to take it out, that's really what you can do. Now, if you have Achilles tendonitis, what you could do is oral anti-inflammatories. Make sure that you check with your physician to make sure that you are healthy enough to take either ibuprofen, Motrin, or Mobic, or meloxicam, which are usually prescription, or Advil, or any of the oral anti-inflammatory medications. Also, you can have a topical anti-inflammatory medication like Voltaren. I personally love Voltaren. I use it as well. That will also help with inflammation. Now, if your Achilles tendon is tight, there's a whole bunch of exercise that you can do for those. A run and stretch is a really good one. It helps to stretch the Achilles tendon, but I usually advise my patients to do it at least 3 times a day. Also, first thing in the morning when you wake up, make sure you do it. While you're just running errands, make sure you do it. Do the run and stretch as much as you can. It'll really help to stretch that Achilles tendon. Also, wearing heel lifts. Remember we talked about how some patients feel, or some people feel more comfortable in shoes that have a little bit of a heel than in flat shoes. Getting a heel lift, which you can get from any store, Walmart, Walgreens, Target, Amazon, will also help to give you a little bit of a lift so you can wear your flat shoes if you so desire and have relief from pain. Icing the area. Ice is tremendous in helping with inflammation, burning, tingling sensations that you may feel there. So icing that area will help with the inflammation in addition to stretch and the heel lift. Those are going to be great alternatives that you can do short of surgery. Now, what are the conservative options also in addition to the stretching and icing and oral medication? We can do physical physical therapy. We can do strapping that we can do in the office if we needed to. It's not really something that you can do at home. You will need to see a foot and ankle specialist like myself to do it for you. We have other treatment modalities like shockwave therapy. And in my office, personally, we do have this, and we've seen tremendous relief in pain, especially with Achilles tendonitis. Now remember, with the bump, there's not really much we can do about it, but we can help to support it and help the Achilles tendon not hurt so much. So if you have any questions or if you were interested in these services, definitely hit us down below, give us a call, and we'll take care of you. Now, if you've tried all of these conservative methods and they are not helping, that's when you may consider surgery. And that's what someone like me, a board certified foot and ankle surgeon and podiatrist, can help you with. If you're interested in seeing me and you have a bump behind your heel or your tendon is hurting and you have questions, leave them down below and I'll answer them to the best of my abilities that I am able to. If you may need further consultation, and if you do, definitely visit our website, www.DeNielFootAndAnkleCenter.com, or give us a call, 832-415-1790, and we can talk about it and figure out the treatment plan that'll work best for you. Remember, foot and ankle pain is not normal. So if you have any foot or ankle pain and we've not discussed it in any of the videos, ask me a question down below and we'll take care of it. Now that you've watched the end of the video, I want to ask you, would you consider subscribing to our channel? I would really appreciate it. And also hit the like button. It'll help the YouTube algorithm to spread this good news to everyone, and people who may have foot problems will also see it as well. Also, share it with your friends and your family, your coworker on Facebook, and all the other social media platforms. You can also find me on Instagram or on TikTok as the same name, the 5-Foot Doctor. So out of all of this conversation that we just had, which one shocked you the most? And which of these exercises would you probably be doing to help with your heel pain? Let me know down below. I'd love to find out about it.